Now, this is video number 2 in response to your comments about this issue of termination of pregnancy. So I'll discuss in this video about what happens before someone gets pregnant. Number 1 is, I want to believe as a medical practitioner, kuna family planning methods, both natural and zile za medical, yeah, what has been prescribed and all that, for those who are sexually active. So number 1, you get from sexually active, now you have engaged in, let's say, unprotected sex. Okay, before you engage to unprotected sex, you are conscious or you're educated about family planning method. For instance, we have the use of barrier method, protective method. That's the condom, for that matter. So umefaili kutumia hiyo. There is a very natural method which is the safe days. Watu wa kawaida mnaita, like in a local language you call the safe days. It works, but only if you have been taught well. Yeah, it works kama umefundishwa inawaka aje, because many people just assume where are the safe days, what happens, what are the risks associated with it, you get. So number 1 is as youth and comrades, we have to learn to manage our engagements. For instance, as much as we are eager, want to do some things, we have to be conscious that there are consequences for everything. Okay? Yeah. So that before you get to a case where now you are pregnant and you have started thinking about abortion, you are very conscious that most likely you are going to get pregnancy, and you are not ready. You are not ready to have a child. That's the discussion that you have to have with your partner. Sindio? Au sio? Yeah. So that imefika that point, you are pregnant. You are ready to maybe talk to your parents. You are ready to talk to your partner and maybe to bring up the kid. So that the last resort, actually in medicine or in healthcare, ethical guidelines, there are considerations for termination of pregnancy at the last options, and it can be prescribed and be monitored. And that's only when umesema yenyewe it is very impossible and it is so hard to bring up that baby. Yeah. We'll have the other videos that are equally important where we shall talk about now it has happened, for instance, or you know someone who has taken the pill, because it is possible you can get mtu, maybe a friend, amekwambia nilipewa dawa and nasikia naumwa hivi. So it's a real life situation that you have to address. Number 1 is, I'll always advise that before one takes that pill, even the emergency contraceptive, that's what is taken 72 hours after engagement in unprotected intercourse. You have to have the health information. You have to know side effects ni gani, so that in any case inakuwa worse, you're able to tell, sindio, and visit the maybe hospital or a clinic or something. Yeah, but for now, let us have a proper discussion and always be eager to engage. If you get same as student, health practitioner, Google, find information. How do family planning works? Especially the natural methods, because that's what most of us use. So that we do not have a case where people are operating on myths. Then you start saying these things do not work. Number 1 is you have to understand your body, like the issue of regular and irregular menses and such, or menstruation cycle. So that ukielewa, you'll be able to know the safe days, because they work. But you have to be very accurate and not ignore. Yeah. See you in the next video, guys. Thank you.